morning, good morning. Thank you guys for coming. And this month, City on the Move would like to welcome Consortia Care, the Arkansas AIDS Foundation. And we're going to talk about, AIDS prevention and if you already have it, the treatment. One of the things we talked about is that what we need to learn is that knowledge is power, because if we know something, we can prevent it, and then if we do have it, we know how to treat it rather than run away from it. So it's time to talk about, AIDS awareness. Today we have Ms. Carlisha Murray. She's with Consortia Care, the Arkansas AIDS Foundation. She's going to talk to us for a little bit, and then she's going to introduce another speaker, okay? Thank you.
Good evening, everyone. I'm Carlisha Murray. I'm with the Arkansas AIDS Foundation Consortia Care, and what we do is we provide hotline service to individuals that are infected with HIV. Today, we're going to share a little bit of knowledge about HIV risk reduction. I have my colleague with me, Mr. Maben, and we've worked together on the Arkansas HIV Planning Group and with other activities. He's going to actually be bringing the presentation for us today. So give him a hand as he comes. Thank you.
Thank you, Carlisha. I really appreciate it. And thanks so much to the staff of Little Rock and everyone involved with planning this event today. I'm always glad to go out and be a part of the community and bring information because knowledge is power. And I'm always glad to be out to answer questions and to make sure that people understand that sometimes the information you get otherwise may not be correct. And a lot of times when I am out and about, I do find that a lot of people are being misinformed, uninformed, and sometimes creating information that is just simply not factual. And so today, not to go real in depth, but I'm going to have do this presentation where we'll offer you some information, some factual information about HIV and AIDS here in Arkansas and nationally. I know it's probably not the best conversation to have during lunch, but we'll try to keep it as light as possible. Again, also it's not overly graphic, so you don't have to worry about that either. I felt that it's always try to temperament whatever presentation I need for wherever I am. I'm so glad that you all did decide to come and attend, and I hope that you'll enjoy it. As the schedule is, we're going to have questions at the end of the presentation, the last 20 minutes of the presentation. So if you would like to hold your questions till then, you can. However, if you've got a burning question that you need to be clarified right at the moment, please don't hesitate to do so, because I also like to have things to be interactive also as well. So again, I really appreciate being here. Just real quickly, what Arkansas RAP stands for. RAPS is an acronym for Reaching, Affirming, Positive, Progressive Systems. We are a community-based entity that goes out to build capacity in the community. We offer educational opportunities around HIV, health literacy, and we also work with a lot of community-based organizations with their testing events, as their Hep C testing events. We also do work as raising health literacy and making sure people understand about their insurance as well. So we do a lot of things connected with health across the board. We don't necessarily particularly have a target population. We try to make sure we go where the people are and where the need is. So again, our organization is Arkansas RAPS. That's Reaching, Affirming, Positive, Progressive Systems. And our ultimate goal is to look at all of the systems that impact those people who live with HIV. Those systems being housing, education, food, transportation, and employment. Those are the systems that we try to do an assessment on and try to see how we can learn better how to make the quality of life of those living with HIV better as far as our organization, as far as our mission and vision. So again, that's who we are as far as Arkansas RAPS, and we'll move forward with the presentation. What should I know about HIV and AIDS? Just kind of real quickly with a raise of hands, what do you know? What do you think you know about HIV and AIDS? What do you know? What's something you know? What's something that you said, I know for a fact about this? Yes, sexual contact, so you do know that. You do know that. Anyone else? Anything that you know about it? Because some people, there's some things you should know about it. Okay. So during this presentation, we're going to try to make sure there's some things when you leave here today that you have at least one or two things that you know for sure that you know about it. And again, if you have questions or something that you want to be clarified, be sure and let me know. We'll be more to do that. Knowing how HIV is spread is primary to this presentation. Learn how HIV affects the body. And consider HIV testing, because most of the testing is free, and a lot of the testing events that I work in, I try to make sure that testing is free so that you'll be able to access that without a lot of cost. Because you can get testing at your primary care physician if you so desire, but as I'm understanding, a lot of primary care physicians are not necessarily asking individuals about that. Why do you think that is so? Why do you think a primary care physician may not ask you about, have you been tested for HIV? because he's probably making an assumption that it wouldn't impact you. And most physicians sometimes do make that assumption. And then when we meet with clinicians and physicians, I tell them, don't make that assumption because you don't know that individual and what their sexual health history is, nor who they are having sex with. So don't make that assumption. And I would encourage you when you deal with your primary care physicians or whoever provides your health care, that also to make sure that they don't make that assumption about you. You can always ask for a test. Make it a part of your routine every year, your checkup, to make sure that you get tested. And that includes whether you're married or not. I want to make sure put that out there too. It'd be good for you to make sure that you get a full battery of testing that includes HIV testing as well as far as your health care, because it is up to you to be responsible for your health care, is it not? So why not ask that question, or either inquire with your doctor why he's not asking you about that, because your sexual health is important as well. Your knowledge can also help you treat people who have HIV in an understanding way as well. What everyone should know about HIV and AIDS. HIV is an acronym for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. And I want to make sure that we're clear about that, because when I'm out and about a lot of times in the community, people sometimes get it twisted and they get it mixed up. HIV is the virus that you will acquire. I want to be clear about that. And then once you have HIV, if it goes untreated, I'm going to make sure I say that, untreated and undealt with as far as your primary care physician or whoever your healthcare provider is, you can progress to AIDS. So HIV and AIDS are not all one and the same. Okay, HIV is the virus that you acquire, and then AIDS is the end result of your HIV being untreated over a period of time. Now, earlier before you came in, we had a slight conversation about, because there's been a lot of chatter and a lot of news about the situation in Atlanta where they're finding a lot of individuals who are what we call late diagnosis with AIDS. And they're like, how did this happen? Well, how that happened is that many of those individuals perhaps may have been diagnosed with HIV, but what did I say before? They didn't get treated. So therefore, they progressed to where they have an AIDS diagnosis. Now, there's a possibility, another scenario, where some of those people could have not even known that they had HIV and gone untreated. That's that situation. And there's also people who perhaps test positive but never go back and get their confirmation tests, because they basically have decided that, well, I got tested, I don't need to know, or I don't want to know. And we have a lot of people who like to live in denial. Literally, like to live in denial. And it amazes me sometimes when I'm dealing with individuals who I'll say, did you get your confirmation test? Why didn't you go back? Well, it'd be better for you to get that confirmation test so we'll know whether or not that preliminary test was actual positive, so we can get you linked to care, because now we have a lot of modalities that are letting people live a lot longer than we ever thought. So again, just that question, if you heard the things about Atlanta, I just wanted to make that a part of this conversation, that many of those individuals most likely were not treated, or either they did not get confirmations, or it's a possibility they were just in denial and decided not to do anything about it. And what happened to them is that they developed symptoms and syndromes later on that drove them to medical care. Therefore, they were considered late diagnosis. So that's sort of the kind of a nutshell about Atlanta to some degree. Now, I'm sure there could be other mitigating facts to that situation, because one thing about HIV, there are many things that impact people living with HIV. As I said before, it could be their housing situation, it could have been their employment situation, it could have been the fact they didn't have any insurance, it could have been the fact that they were not knowledgeable about HIV. So there's a lot of other mitigating facts, and I don't always like the people say sometimes, well, it's their behavior. That's just simply not true. There could be a lot of other mitigating facts that could have a person begin to perhaps, on the progression to have AIDS as opposed to being infected with HIV. So we just want to make sure we clarify that. And also to make sure that we're clear on exactly what HIV is and what AIDS is. Are we pretty clear on that? So that's one thing you can take away from today, right? At least one, okay. HIV weakens the immune system. The immune system is the body's natural defense against illness. One can be infected with HIV for years and not have any symptoms Again, back to the point of Atlanta that we talked about, over the years, they can have no symptoms. And also, if they don't go to get any medical help or any confirmations, they won't know. By the age stage, which is what we call latent age stage, where you've developed symptoms and problems, the immune system is very weak. The immune system will not be able to protect against illness very well. Now, for some of those individuals, they might have been encountering that particular stage at that particular point. But again, as we said before, that is over a period of time. It's not like weeks. It's not like months. It could be years before anything shows up where they're going to have issues around it. How HIV affects the body. HIV invades the body through bodily fluids such as semen, blood, vaginal fluids, and breast milk. The immune system tries to fight back but can't kill all the HIV or keep it from replicating. There may be no external signs of HIV. And I really want to talk about that last bullet point. Recently, I was at Arkansas Baptist College, again, doing one of these presentations with some college students, and one of the students stood up and told me, he says, I know when I see HIV because I can see them. And I told him, really? So I asked him exactly, what do you see? And so he laid out the things that he thought that he saw in a person that would recognize them having HIV, and I let him know that that has no truth to it whatsoever. It simply don't. And I told him it would be best for him not to repeat those things and for him to get educated, because HIV is not something you can see. It is no model of HIV per se. Now, at one point back 30 years ago, 3 decades ago, since I was there at that early beginning of time, of course, we had people who had various outward signs that would show you or demonstrate that they were ill and possibly had a weakened immune system and possibly had HIV, which, of course, at that time were known as GRID. So we did have some situations where people had some visible, outcomes from it. But this day and time, that's simply not true. You cannot say that person over there has got HIV, because you just can't say that. You cannot say it at all. And I hope that young man will refrain from saying that ever again after I talk with him on that day. So again, making the point here, there may be no external signs of HIV. So if there's no external signs, what you should probably do when you're talking with your partner or whoever you decide to be intimate with, you might need to have them conversations with them, right? You might need to ask them, when was the last time they were tested? You might need to ask the last time, when were you tested? And another thing that I do when I deal with, especially couples who are about to be married, I said, you should come by this HIV house before you go over there to the marriage house, so that you know that when y'all going down the aisle, y'all all going down the aisle knowing who is what. Because you don't want to get to the marriage aisle and then get to the honeymoon and then something else comes up. So I always encourage those couples to know the facts before you get on with your life and understand the facts about it. Because you don't want to later on say, well, look here, I meant to tell you about this. Because at that point, you don't want to hear that. And I have dealt with some married couples, especially women, who will come and tell me they didn't tell me. And I'm like, well, you'll need to have that conversation at some point before you go down the aisle, because you want to make sure you all are going down the aisle both with a negative status. And you want to be sure that you know about that. And I have actually had some couples come in where they are tested together, so they will be able to know that on that day. But I always let them know, just because you got these results today, you need to be sure to follow up on that. So just don't make sure that just because it's today that it's going to always be. So make sure to follow up on that. How HIV affects the body continuum. A person with HIV doesn't have to look or feel sick to be able to infect you, as I said before. 1 in 8 people don't know they have the virus. 1 in 8 people don't know it. So if they don't know it, then what? They could possibly infect you if they don't know it. And I've heard that over and over and over from people who I've had to deal with I got linked into care. It's just, I didn't know. Now, and of course, we know that because of the fact that these days we're not hearing as many messages, we're not seeing advertisements, we're not seeing billboards, because earlier in the years we used to see all kind of messaging on TV and magazines and all of that nowadays. Of course, now things have shifted, because now we're talking about the treatment that's available. And I'm often talking about, let's go back and talk about some of those prevention messages. Let's put some of that messaging back out there, because if 1 in 8 people don't know it, we're going to still continue to have a problem. And as we go through this, I'll show you some other issues around that, not knowing. Just a few statistics. I try not to get too many statistics because it becomes overwhelming. But I thought these were really important. Currently, there are 37 million individuals living with HIV across the globe. 37 million. 21 million people are on ARV treatments, and that's retroviral treatments. That's the pills that we have for the treatment that we have for HIV. Nowadays, basically, where we are with the treatment, which is amazing because I was there all those 30 years ago, when I dealt with individuals who had to take 15 and 20 pills a day, and they were toxic and they were sick, and a lot of times it was just not very good medication because they were given what they could actually get. Today, we have individuals who only take one pill a day. One pill. And then within that pill, basically, it has all the medication to virally suppress the individual and will not allow HIV to replicate in their bloodstream. And again, we'll talk more about that as we go along. 17 million people need treatment and don't have access. So we got to worry about that number. 17 million people need treatment and don't have access. Why do you think they don't have access? No insurance. That's one. That could be the first one. Lack of resources. They could be homeless. They could be unknowledgeable. They could be in denial. They could not have a good health literacy. So there's various reasons why those people could probably not have access. In the U.S., we have 37,600 new infections yearly, of which 36% are heterosexual. Now, those of us who work in the field, we sort of applauded that to some degree because just a few years ago, it was 50,000 new infections. And so for us to see that it had reduced to 37,600 was encouraging. Of course, that's not good either, but it is an encouragement that we are trying to make an impact to get things down. We do have a plan and some visions toward trying to end HIV and AIDS by 2030. Now, whether we're going to get there or not, I'm not really sure. But if we continue to reduce that number, perhaps we might be able to. And if we increase the awareness and increase the access to treatment, perhaps we may be able to get to that. So we're looking at that 37,600 and thinking, well, that's a good start, but we got a lot of work to do. Since 1982, 36 million people have died. Think about that. 36 million people have died. And of all that 36 million, I know some of my friends and colleagues and loved ones and people who I knew are amongst that 36 million from all those years ago. Currently, here in Arkansas, we have 5,308 individuals living with HIV. 5,308. Now, I use that number because that's the number that's reported to AIDSView, which is a tracking device from the federal government that lets us know about our reporting situation. However, as we said before, if we got some people, 1 in 8, who don't know, and then we got other people who perhaps are not in care, our 5,308 may not be quite as accurate because we got people who don't know, who are not in care. But as a part of reporting purposes and our government reporting purposes, we have 5,308 Arkansans living with HIV in Arkansas. How is HIV spread? Of course, we've talked about through sex, vaginal, anal, or oral sex. And a lot of times when I'm on college campuses, a lot of the college kids will tell me that oral sex is not sex. And I have to correct them and tell them, yes, it is. I can't tell you how many times I've heard that on college campus for some of the young people we're doing testing events, and they'll come to me and we'll be doing an assessment. They'll say, well, all I have is just oral sex. And I'm like, so you don't think that's sex? They said, no, it's not. I said, oh, but it is. It is. So in some of their minds, they've decided to opt out oral sex as opposed to anal or vaginal sex. When sharing a needle with an affected person, we know that you can spread HIV that way. Between a mother who has HIV and her baby, even though not as much now as we had in earlier years. Blood-to-blood contact with an infected person. So those are some of the ways how HIV spread. And again, I want to clarify on that because again, out in my community talks and when I'm educating, I continue to hear all kinds of out there responses about that. Some people say that, they still hear about mosquitoes. I tell them, no mosquitoes are not spreading HIV. No toilet seats are HIV infected. You're not getting it from eating in some certain restaurants in certain parts of the city or something like that. No. So I'm continuing to deal with younger people who simply continue to deal with those urban myths. And as I said before, misinformation, miscommunication, and just not getting no facts and just getting lots of foolishness. And they're spreading it amongst each other. And I always tell them, you need to corroborate that. How could that possibly be? Just think about that for a minute. And again, back to that college here locally where this young people were talking to me about HIV, and one of them said, well, most of the people who had Ebola had HIV. I says, no, that is two different situations. Two different situations. And again, this is college kids now that I'm talking to at this campus. So, I mean, we have to make sure that we understand the distinctions and the differences, and that Ebola is not HIV and HIV is not Ebola. They're not the same. These are how we spread HIV, pretty much so. How is HIV not spread? Now, this is what we need to talk about. Sitting next to someone. No, you cannot get HIV from sitting next to someone. Not on the church pew, not in the movie house, not on the bus. Nowhere can you get it by sitting next to someone. Shaking hands. Absolutely not. You cannot get HIV shaking hands. Eating in a restaurant. Sharing food. Using restrooms. And believe it or not, I continue to hear that over and over and over. And when I'm going across Arkansas, and of course I understand in some of the smaller communities, maybe the information has not necessarily been updated or perhaps not really shared. And it may not have had an advocate like myself or an expert like myself to be out there. But I do try to make sure that I point them in a direction as to get the best possible information and let them know this is not. Because in some of those small towns, some people are still believing this. And they're causing stigma for those individuals who are living with HIV. Again, not by swimming, not by donating blood, and again, not by bitten by insects. Because I'm still hearing some of those things out there too, which to me is amazing. Because you know that HIV and us dealing with it, we've been doing it now for 3 decades. 3 decades, 30 years. And when I think about that, even though I've not necessarily been doing the work for 30 years, but I've been around it for almost 30 years, and it continues to bother me when I continue to hear individuals, especially high school and college students, who don't quite have it understood about what HIV is and continue to say things and pass on information that is not true. Now, where they're getting that from is, of course, amongst their networks of friends, and I'm not sure if their parents are educated about it, because probably they're not. And probably people in their communities are not very educated about it. So it's our job to try to get out there and communicate about how HIV is not spread. Currently, the Center for Disease Control now acknowledges that individuals living with HIV in a treatment regimen plus virally suppressed are not infectious. And I want to really emphasize that, because that is a new designation from the Center for Disease Control, is that individuals who are on their regimens are what we call virally suppressed. And virally suppressed means that there are low detections of the virus in their blood. So therefore, they cannot infect anyone if they are virally suppressed. They cannot. And there's been a variety of studies, too many studies, I don't want to mention them all here, but they did a lot of studies over a period of time to actually make that determination. And now the CDC, the Center for Disease Control, in case you don't know what that is, has agreed that those people who are on a regimen of their medication, who can be officially determined virally suppressed, cannot infect anyone with HIV. So just want to make that is something kind of relatively new, where people are not understanding that because they didn't know anything about that, because people understand what virally suppressed is or undetectable. But the CDC has officially said that that is the case. Now, we want to talk about a few signs and symptoms. And actually, when we did this presentation, we put this together. I decided to put this in here because actually some of these signs and symptoms are symptoms from some days ago. We don't see this as much now, such as swollen lymph glands, recurrent fever and night sweats, rapid weight loss for no apparent reason, constant tiredness, diarrhea, and decreased appetite. In the beginning of the epidemic, we saw a lot of this. It was very clear as we looked at individuals, but we don't see as much of this nowadays, per se. Now, because earlier you heard me say that there were no outward exhibitions of the disease. And seeing, even with these possible signs and symptoms, we don't see that as much these days as we did, I would say, some 25 years ago, when you saw a lot of this. And a lot of individuals suffer from this. Again, looking backwards from about 30 years ago, and we don't see it as much now. However, I want to clarify that there's a possibility that you could see some of these signs and symptoms in individuals. Just because it may not be as prevalent now, it could still be happening. Thrush in the mouth is the late stage HIV. Skin rashes are the acute stages of HIV, which is the beginning. Frequent oral or vaginal yeast infections, short-term memory, and neuropathy. I will say in some of the clients that I've engaged recently, I've seen a lot of neuropathy where people are having issues with their hands and their feet. But again, that is, I would not say, widespread. I think a lot of times it depends on the individual. One thing I want to make clear about HIV affects people in different ways, all different ways. So just because you see some signs here, everyone may not, have that happen to them. Some people have a little bit, some people have none, and then some people may have them all. It just depends. It depends on the individual system, as it is with any chronic disease. It depends on your system, and it depends on how well you take care of yourself, what you do about your medicine, and how you decide to live your life. So it depends on what happens to you as far as that's concerned. We constantly encourage people to make sure that you get a good health team, get a good provider, and understand what you need to do to live a better quality of life, as far as regimens, as far as medications, and also just general wellness. What are you eating? Are you exercising? All of those things that we hear all the time anyway from our primary care physician. I certainly hear it all the time. After I go in, when you gonna get to that gym? I say, real soon. Real soon. So we all say those things when we go in and hear from our primary care physician what we're going to do as our life and making sure our wellness is better. Now, when we move on to talking about signs of AIDS, and I thought we'd put this in here as well, just so we can, for context, pre-existing diagnosis of HIV infection is a 200 T cell. Once you reach a 200 T cell count, this is where they've decided to diagnose you as having AIDS. And this is a clinical situation, and that a doctor or physician or whoever your healthcare team has to make that diagnosis. You cannot self-diagnose yourself. They have to make that diagnosis as to what's happened to you. And it could be that you could experience one or more opportunistic infections like pneumocystis or corpuscular sarcoma, which we don't see as much now. We did see this in early years. We don't see that as much now, but it doesn't mean that someone couldn't be experiencing that. As I said before, all these symptoms and signs we're talking about, it depends on the individual, it depends on their access to health care and how they're living their lives. So we have to understand that these opportunistic infections I'm talking about, as well as other particular outcomes, it just depends on that individual. Now, moving on to talk about HIV treatment, which is a really important thing for me to talk about, because once a person tests positive for HIV, medication may be given to treat HIV as a chronic disease. And I do talk about that often because it is a chronic situation where you can live a long life with HIV. With daily treatment, an individual can live a normal life. 50% of those living with HIV now are over 50 years of age. Over 50 years. I know one individual who is 84. Had HIV for more than 30 years, doing well, basically dealing with what we call aging issues. That's our new frontier now as far as those who live with HIV, is that because some people didn't know they were going to live that long because we had some people dying in the early years. But at this particular point, and that includes women as well as men, it's not just men, we're dealing with aging issues. So when we talk about aging issues, what are we talking about? We're talking about arthritis, could be diabetes. We got to talk about long-term care facilities. We got to talk about, maybe, how people are going to live in health homes, who may need assistance. But again, the point is 50% of the people with living HIV now are over 50. Over 50. And that's significant. And why is that? It's because the medication has sustained them to live over 50 years of age. HIV treatment can prevent AIDS and other opportunistic infections from developing, preserve the body's immune system, prolong life with a 1 pill a day regimen, as I said before, 1 pill a day, And then we now have basically developed what we call pre-exposure prophylaxis, which is called PrEP, which is a new modality that actually helps individuals who are not HIV positive not to be HIV positive. So that's a new drug in our toolkit as far as creating wellness and health in the communities. And it is available here in Arkansas. We do have doctors who prescribe it, and we do have actually a PrEP clinic that you can go and get information there. Now, accessing that drug is not just a mere whim. It is something that you have to do daily for it to work and for it to absorb into your body. Also, that particular drug is not one that is cheap, as most drugs are not. So you have to consider all of those factors. You would get with your primary care physician, go through the protocol to see if you qualify for that. But that is available out there, and it's called pre-exposure prophylaxis. It's called PrEP, and it is available. And you can talk to your primary care physician, or you can talk to me afterwards, and I can give you more information about the PrEP clinic we do have here in Little Rock. Treatment must be given under the care of a doctor, nurse practitioners, infectious disease specialist, primary care physician who is providing your health care. Persons who test positive for HIV should see their doctor regularly for follow-up care and testing. Make sure they have access to stable housing through programs such as HOPWA, which is a housing opportunity for people with AIDS. And the reason that we add that particular caveat there is because we believe housing is treatment. It's treatment. You know why it's treatment? Because you're more likely to adhere to your drug regimen if you have stable housing. Now, if you are living homelessly, your priority is not necessarily take no pills, now is it? If your housing situation is in jeopardy, your priority is otherwise. It's to find shelter, it's to find warmth, to stay out of the weather. And sometimes when we know that people who need to be on their regimens, if that is not their priority, and that priority is to find housing, then we should consider housing as treatment and a part of our treatment plan. And I certainly preach that and talk about that in all of my sessions, that housing is treatment. There's a lot of things that are considered treatment that other than just pills. So we have to always understand that as well. And that's the reason we have HOPWA services provided by the Arkansas AIDS Foundation. And hopefully you have more questions about that. We're going to have some information at the end where you can find out how you can find out more about that as well. And we'll take questions as well. During your risk and your status, risks may include having unprotected vaginal, anal, oral with a man or woman infected with HIV, sharing needles or syringes for any reasons, exposure to sexually transmitted diseases that includes syphilis, gonorrhea, and all of those. Alcohol and recreational drugs reduce judgment factors because when we have alcohol and drugs involved in our relations, what do we possibly do? We kind of let our guard down. We become a little bit more fluid. Our decisions become a little bit more malleable. So we always make people understand that when you are in that particular state of mind, please understand that you need to be still responsible for your sexual health. You know, make sure the person that you're with, you've had that conversation with if all possible. Make sure there are condoms available, both male or female condoms. How many of you have seen a female condom? You see a female condom? You see them? Good. Yeah, they are still available. And then out through our organization, we try to make sure when we do health fairs, we try to make sure those are available for both men and women. And I encourage women to, hey, when you talk to your male partner or whomever, let them know this is how it's going to go. If you're not going to wear one, I got one for you. I mean, because you got to be responsible for your sexual health as well. And if your male partner decides that he's not going to do that for whatever reasons, then you need to maybe take that next precautionary step for yourself, especially if you are not 100% sure that he is not HIV positive or any other sexual infection. So I always encourage people to understand that women condoms are available, and don't be afraid to roll that out on a brother. Because that will get his attention, that you mean business about this. Because we know that amongst women, HIV is very prevalent amongst women right now. And we know here in Arkansas, at least 23% of the people living with HIV are women. And of that 23%, we know a great deal percentage of that are black women. So I make sure that I emphasize that you need to be in control as well and understand that, you know, if you're not going to have that conversation with him, you might need to wait a minute before we move forward being intimate. So it's really important that we do that. We're talking about sharing needles and syringes. Of course, right now we have a whole opioid situation going on. We've got people who simply are not understanding that issue. And that is a very important issue that we need to continue to talk about the sharing these needles. We've got Hep C situations, Hep B, all of this going on. So you need to understand that as well. And if you don't understand it or don't know, get some information about it, because it's important that we all become informed about hepatitis and how it's affecting our community. Understanding HIV test results. A positive means a person has HIV antibodies. When we do the test, we're looking for antibodies. And I'm going to show you some of the tests in just a second here. A negative means the test did not find antibodies. If we get a test that is negative, we didn't find any antibodies. It could take up to 6 months or longer after infection to get a positive test result. I have people all the time who have some kind of encounter the night before, and my phone ringing the next morning about, look here, can you test me? I'm like, well, when did this happen? Well, it happened last night. Well, ain't nothing I can do for you. That I can test you, but it would not give you no results because it take up to 6 months. And people need to understand that. And see, sometimes after that heightened experience or that encounter you may have, and then all of a sudden you come to yourself and we're like, oh, wait a minute, I didn't really do the right thing, so I better go get checked. But you need to, we need up to 6 months for anything will be able to be noticed. And this is what one of the tests looks like, pretty much so. You can see that test there. On that side, it's the negative one. You see that's the negative from there. And then this will be a positive result here. These are oral tests that take about 20 minutes. Now, we'll say this test right now has really been superseded. We now have a test where we can give it to you in almost a minute. So the science on these tests are moving really, really quickly. And most of these tests, if not all these tests, are 99% accurate. I have never had one of these tests fail me yet so far, pretty much so. Whether they be a negative or a positive result. And the positive result you can see there would be both of those bars. Even a faintness over there could still be a positive result. So it's about a mouth swab up, door, and we put in the solution and you know it in 20 minutes. So there's no reason you're not to be able to know. And of course, like I said, there's been a new test, some other tests developed that are now about a minute. So we've got stuff moving really quickly because we want to make sure we can get that information out there. But that's what they look like. HIV testing is simple and reliable, and just some other information that we got as far as how you can contact us as far as our website is arkansasraps.com. I have a lot of information out there, including videos, links to all kinds of information. I work on that almost weekly to make sure it gets updated, and those are some of the phone numbers there. We'll try to make sure that is available to the staff here so you can be able to get access to that for your own purposes. And some statistics in Arkansas real quickly. We know 54% of the 2015 cases were African American. We do know that is where our epicenter is amongst our community here in Arkansas. However, African Americans represent 15% of the total Arkansas population. So what I'm saying here is that over 54% of the new cases are African Americans, but they're only 15% of the state's population. That should be disturbing to us. It certainly should be disturbing to us. Again, African American and Hispanic and Latino men comprise 58% of all new HIV infections. However, men make up only 11% of the general population in Arkansas. Again, a number that makes us disturbed. And finally, young African American MSMs, which stands for men having sex with men, 13 to 24 alone comprise of 50% of the new HIV infections, though they are less than 3% of the general population. So those are some of our statistics that really have caught our attention in our discussions and our planning at the Department of Health as well as the Arkansas Planning Group. And just a few other statistics there. We know that in 2015, 258 adults and adolescents were diagnosed with HIV in Arkansas. And Arkansas ranked 30th among the 50 states in the number of HIV diagnoses in 2015. As you can understand, some of our data is sort of a year behind. So as we move forward, this data will be updated. The state has increased its testing goal by 37%, which is encouraging. And as of 2016, there were 314 new cases and 81% increase in HIV status awareness. And what status awareness means is that people know their HIV status. And that includes some partner services as well. And when we talk about partner services, that means that they've notified partners. There's a statewide network of medical providers and federally qualified health centers to help you with HIV services. And with that, we'll take some questions. I hope that you've learned at least one thing. As I said before, when you leave here today, you should know at least one new thing, or maybe even two new things, and hopefully three new things that you can take away and share with someone that perhaps may not know information. So we'll take some quick questions at this time, please.